Hi, and welcome to Seat Meets Table, the podcast that brings people together. I am your host, Sam O'Hara-Childs, and in the seat today is Debi Evans. Hi Debbie, how are you doing today?
Sam, it's great to be here. We got here at last.
At long last.
At last.
Yeah.
I got to Plymouth and we got to speak face to face.
Indeed,
yes.
It's great to see you. Great to have you here. I wanted to begin by asking, did you have strong morals as a child?
It's a really good question, actually. I think they've become stronger as I've got older. However, what I will say is that maybe not so much morals, although that probably ties in. I was always a very inquisitive child. I was always asking questions. And people used to say to me, stop asking questions.
That's enough now, please stop.
All the time, literally all the time. Why is the sky blue? And my grandmother bought me these magazines. They were called Tell Me Why. And you'd collect one a week and then you'd get a beautiful black folder. And it was Tell Me Why, tell me how deep the sea is, tell me why the sky is blue, tell me all these questions. So I was always very inquisitive. I was always very curious and I always challenged. And of course, the grown-ups never really liked that because I would always ask questions that perhaps I shouldn't ask. Maybe a bit inappropriate.
So you're trying to get to the bottom of things.
Always. Yeah. Don't like secrets. And I like to know things. I'm nosy. I've always been nosy. Gobby Granny is what my kids call me now.
Nice, that's a pretty good one, yeah.
Yeah, nosy, I think. Yeah.
All right. What makes a good nurse?
I've always said... I've wanted to be a nurse ever since I was 8 or 9.
So the morals were there then as a young child?
Oh, yeah. I guess they were. Oh, always. Yeah. Always, wanting to help. And I don't think you can make a nurse. I think nurses
born,
are
not made?
born.
Like good boxers? All right.
I do. I genuinely do. I think there's something within... Any nurses that are listening to this now that trained back in the day when I did, we fought for our places. You know, it wasn't a case of, oh, the NHS is desperate. They'll take anybody like it is now where you don't know who you're seeing. In my day, it was 70 places and there were 400 of us applying for those 70 places. So it was very much a career. It was a vocation.
A calling as well.
It was a calling. And I wrote to Barts when I was 11 years old. Wow. 11 years old. And I said, please, can I come to your hospital when I'm older? And they said they'd be delighted to have me at their hospital when I got to 18. And it was my dream. It was absolutely my dream. I had to go to a London teaching hospital because I'm from London. But I wanted to go to Barts in particular.
Why that one in particular?
I don't know. It was always Barts.
Was it in a film or a book or a magazine you saw?
I don't remember. I think it was just in London back in the 60s, in the 70s. Barts was, if you like, the mother of teaching hospitals. It was
so it specialised in training.
Well, they were all teaching hospitals. They were all training hospitals, but Barts
best of the best, kind of?
Yeah, there might have been. I'm sure a lot of people would be going, no, my hospital was because it was a lot of competition.
Yeah, of course.
But anyway, I did get to Barts eventually, but I didn't train at Barts. I trained at the Royal Free. But from there on in, I was driven. All I wanted to do was nurse. And my mother kept taking me to ballet classes and I was like a baby elephant.
I'd rather be nursing, thank you very much.
Oh, and...
or if someone hurt their foot at ballet class, then you could jump in.
Yeah, exactly. I could help. But no, so nursing was always, it was set in my head and there was no shifting me.
But
there was
why?
No
what is the driver? Just the simple drive to help others, to care? What's the source of it?
It's in you. It was in my soul. And I think nurses that trained alongside me. I mean, when I started training, there were 70 of us that started for a 3-year training. And at the end of 3 years, there were 67 of us left. Right. 67 of us had qualified. And the only ones that had gone were ones that had got married or were having babies. So we were all taken in at 18. We were all the same age. We'd all left home for the first time.
Yeah.
But I think all of us, you know, when I think about the amazing training that I had, and the company that I had in the nurses' home, we all felt the same. We all wanted to be nurses. There was no question in our heads whether it was, I mean, it sounds really cheesy, doesn't it, to say, I just wanted to help the sick. I just wanted to help people. It sounds really cheesy, but I actually did. But it didn't have to be ill people. I just wanted to help anybody, really.
So the appeal is to heal others?
Help. Hold hands. Holding hands.
Are you quite a tactile person?
Really tactile. Really tactile. And I think that's where we've missed so much recently. In my day, nursing isn't what nursing is today. So when you're asking me how I was as a nurse.
It's different.
I was making beds. I was emptying bedpans. I was emptying catheter bags. I was making 28 beds by 8:30 in the morning. You know, we were doing all of this basic nursing care, which was absolutely central to patient care.
Yeah, all the nuts and bolts of what it goes in to take care of someone. Yeah.
And the patients would know when we were on the ward because they'd hear our uniforms bustling. And we'd be around the ward all the time. They would see us constantly. You don't do that now. And when I was speaking, the other girls that trained, because it was all girls back in my day. We didn't have any guys that were training as a nurse. It was all girls. And we all felt the same. You know, what made you start nurse? Well, I've always wanted to be a nurse.
Just that idea of the calling today is fascinating to me.
It's a drive. It's such a drive. And the uniform, I've got to say.
Smart uniform.
I did like the uniform.
Nice, just crisp.
You know what? It was that starched pinny.
Yeah.
And it was the hat, the cap, everything that went, it was the pride.
Yeah, I get that. I see.
And also, I think it was at the time we were all moaning about all of our friends that went to university and they were all bumming around, going to lectures and then going to parties and having fun.
So there's a seriousness to what you were doing?
There was. And it was, well, hang on a minute. We're working 40-hour weeks. Yeah. Or 37 and a half, actually, they went down to. But we're working 37 and a half hour weeks. And we're having to work all day and study for our exams. Yeah. And socialise. So we thought we were getting a bad deal. But actually, we were getting an amazing deal. Because I left home and my mother drove me to the nurses' home, which was amazing. It was right next door to the pub. In the middle of Hampstead. In the middle of Hampstead.
It's a location, definitely.
Incredible. £5 a week. We had our own home warden, because it was a bit like a boarding school, really.
Yeah, I can see that, yeah.
No men allowed.
Sure.
No medical students, no doctors allowed.
Sure.
So we had this we had a nurses' home. We had subsidised laundry. All our uniforms went to the hospital laundry.
Package then, really, yeah.
Oh, minibus came and took us to work in the morning, brought us back in the evening.
It's almost like being in the military.
Subsidised canteen. It was, but it was with care.
Sure.
There was the discipline and there was the routine and there were the standards. Yeah. And that's what's gone now. And those standards were so high. I mean, there was no way I would be able to just, come home from a shift, stick my stick my uniform in the washing machine. I could get dismissed for that. Well, it would have to go to the hospital laundry to be boiled.
Yeah, I mean, that's part of my next question where it's already leading anyways. How has the NHS changed since your time there?
It hasn't changed. It has completely. The NHS that I trained in has gone.
Okay.
Is gone completely.
And this is the 80s you trained?
I trained in the 70s.
70s, right.
I trained 1976 to 1979.
Right.
And we were probably some of the last nurses, I think, to go through an apprenticeship. And then they brought in this stupid Project 2000. And I'm sure there are a lot of nurses now listening to this that have trained on Project 2000. And have gone to university, so they become university graduates. So we went from apprentices.
Nurses. Yeah, big difference there.
Yeah, I was talking to Dr. Ahmed Malek not so long back, and his wife is a doctor, and she was very pro the idea of university nurses and nurses having this university training. And I'm going, hang on a minute. Actually, we went to school. So we called it school back in our time. So we went to nursing school, but then they changed it so that nurses would go to university and they'd be at university for 18 months. Then they'd go on the wards and discover they didn't really like it, and they'd all leave. And you don't need a university training to hold someone's hand. You don't need a university training to make a bed, to wash someone, to talk to someone, to touch someone, to care for someone. You do not need those university qualifications.
So an over-focus on theory or the technicalities of it now?
Everything.
Opposed to the care.
Well, it's interesting you say that, because I read an article the other day that said, should we take the caring out of nurse?
Who wrote that?
A professor of nursing. And she said that if the general public, and this is what I'm finding, the general public, they're looking back and they want to see nurses on the ward.
Of course.
They want to see uniforms. But that's not what nurses are doing now. Nurses are no longer there to take your pulse. They're no longer there to care for you. They're there to manage.
Take temperature, look at
No.
machines.
Looking at machines. So it's the health care assistants. Take note of that word, care. Health care assistants who do the caring.
As they've split the roles.
Split it. So now people are saying, well, if the public are expecting a nurse to come in and look after you, then you're going to be disappointed. And I was horrified. I'm like, what?
Yeah.
That's exactly what you would expect a nurse to do.
Yeah.
Is to be there to hold your hand, to interpret for the doctor. Because, you know, sometimes these doctors come
There's a big gap, isn't there? The nurse is the
Huge.
middle woman between the patient and the doctor.
Yeah. Nobody likes being in hospital. Nobody wants to go into hospital. The smells are different. The routine's different. The people are different. You're worried about what's going on at home. Who's feeding the cat? Who's feeding the dog? Who's picking up my pension? All of these things. Nobody wants to be in hospital. And yet now we've got to a point where we're almost being made to feel guilty if we need care. And if we do need care, who are we going to get that care from? We don't know who we're going into the NHS to get care from today. In my day, you knew who a nurse was, and you knew who a doctor was, and you knew who a porter was, and you knew who a nursing auxiliary was. But now, everybody wears the same uniform as scrubs, and the caring is done by healthcare assistants, while the nurses... You might not even see a qualified
More
nurse
like technicians now then, looking at machines
Junior
and getting
doctors.
readouts and stuff.
Junior doctors.
Right.
And that's where we've gone wrong, Sam. So in my day, I would be looking at you as a patient and I would be taking your pulse I'd be holding your wrist and I'd be taking your pulse for rate, rhythm and volume. And I'd be feeling the beats. I'd be counting them. You can't do that on a machine. So I'd be looking at you, my patient, not a machine. Why are nurses looking at machines?
And also the patient will feel far less cared for.
Well, they're not being spoken to.
Yeah. And without that touch, you feel it's almost like a surrogate mother, isn't it, in a way, or auntie. A good nurse should be that. And if it's just a person looking at a machine, that's very different.
It's really unnerving. Because patients, this is what I say, people don't want to be in hospital. You need reassurance.
Yeah.
And if your family are ringing, you want that message. Your family have rung. Oh, by the way, Mrs. Potts, your daughter rang this morning.
Sure.
And that makes all the difference for Mrs. Potts.
Personal touch.
The daughter's rung. She'll be in later this afternoon. It takes 2 seconds. Now, relatives, in my day, relatives were our regulators. They were the regulator because they'd come on the ward and they would look at the bottom. They'd look at the charts.
Check the standards.
At the bottom. Make sure that their relative is in a clean bed, clean sheets every day. Make sure that their relative had had a drink. Can they get their water? They bring in magazines, bring in flowers. We'd have flowers.
Sure.
Nothing like that now.
So they've overcomplicated it and removed the care. Would that be a summary?
They've removed the human touch. They've removed the caring. They've removed empathy. TLC, tender loving care. That's my mantra. Tender loving care and do no harm.
Yeah.
And it's no longer like that. And I feel like sort of grabbing every single young nurse I see and telling them what I was told when I started training, which is wherever you are, whichever ward you are in, the patients that you're looking after could be your mum, your sister, your brother, your uncle, your husband, your child.
Sure.
Treat them as though they were one of your family. Because God forbid it could be you one day. And it could be your family.
That's part of it, isn't it? What goes around comes around.
Exactly.
In a macro sense.
Exactly.
Right down to the micro. I mean, we've kind of covered it already. But I'd like to ask more explicitly, what is your purpose on earth, do you feel?
Until recently, I was searching. I think like a lot of people are. I think a lot of people go, why am I here? You know, what am I trying to learn? And how can I learn things if I'm not taught what lessons to learn? And because I always used to say, where's the rule book then? Because people were telling me, oh, you've done this. Oh, you've done that. And I'd go, well, where's the life rule book? Because I'm just winging it really. Sure. But now, in these last 5 years since COVID, I honestly do believe that I'm here as some people would call me a light worker or a truth worker.
Right.
I see that my curious and inquisitive mind, my inquiring mind that I had as a child, has all developed over time into a researcher. So I believe that I'm here to research, to join dots perhaps that other people might not be able to see or can't see, and to be able to tell the truth as I see it. And I'm always very wary of joining dots and being here to give information, because what I try to do is throw it out to people to say, look, this is what I'm seeing. I'm seeing this dot and this dot and this dot, and this is what the picture is. Do you agree? So I try very hard not to throw things down people's throats, but just to make them aware that these are the dots that exist, and maybe you might like to look at them yourself. So I think I'm here to tell the truth. I think I'm here to be nosy, which is what I started off as.
Let me just take a quick break to get the cat.
I knew you'd do that.
Taking off from the last point, do you believe, in terms of digging for the truth, how is that married to your initial drive as a nurse? Are you trying to find the truth to help people, to heal people? I know you often focus on health as a subject in your research. Is it to try and prioritise the best methods for medicine, for healing, to get the truth out there to people?
Yes.
In terms of the two drives combined, you know what I mean?
Yeah, I think that's an interesting question. Yeah, it's a very interesting question. And as I look at my past and I look at where I am now, yes, I would say that they're two intrinsically linked.
Yeah. Completely
linked. Because of course, I'm interested in people's health, but I'm an allopathic nurse. And by that, I mean, you know, I was trained in pharmaceuticals.
Right.
So I've nursed in an environment where we haven't had herbal medicines, alternative therapists. So I'm an allopathic nurse. And I think now I just want to make sure that people are not just getting the truth, but they're getting the best care they can.
Right.
And if that's not the NHS, or if I don't feel that they're going to get safe and adequate care in the NHS, then I feel that perhaps people need to be alert and not alarmed, alert, so that they're in the know. And I'm finding a lot of people saying to me, oh, you know, the NHS has changed so much. We're worried, we're frightened about going into the NHS, we're scared. And I think part of my role is to say, I get that you're worried, and I get that the NHS has changed, and I get that healthcare has changed. But let's put in some coping mechanisms to make it safe for you, to make it safe for your loved one, to make it safe for your family. So I kind of think I'm trying to give as many little tips and coping strategies as I can.
So the goal is the same as it was before then, really. Try and get the best care for people.
Best care. Do no harm. Tender, loving care. So
it's the same methods you work, or the principles you work for from since you were 18 or whatever. Really.
Yeah, intrinsically linked. Because that's what I was trained to do, is to give the best care.
Yeah.
So anything other than that is compromising.
I've thought of a good phrase for you.
Go on.
You're kind of a digital nurse now.
I'm a what?
Digital nurse.
A digital nurse.
Not in a bad way. Or an information nurse.
I'm certainly not a digital nurse.
We'll take that out. Information nurse.
Take the digital out.
Or a truth nurse.
I'm a truth nurse. I'm a paper and pen nurse. I'm a Cardex nurse.
I don't mean digital in terms of like a weird AI hologram version of Debbie, which would be funny.
Oh, yeah.
I mean someone who the care is continuing, but the methods are different.
Yeah.
You know?
Yeah.
But the principle is the same. The motive is the same.
The principle's the same. Let's get back. It's funny you say the word digital, because immediately I hear the word digital, I hear NHS app, digital.
Yeah,
Let's get back to paper.
Sure.
Paper and pens. Old-fashioned belts and braces. Common sense. That's what we need to get back to.
Simplify things.
Yeah, totally.
Talking of simplifying things and the opposite of that, or perhaps not, why should we be skeptical of huge organisations, do you think? UN, WEF, was it MRSA? MHRA. Who
have just today appointed a new CEO. More to come on that. I'm digging into him. So Dame June's definitely, she's on her way. Large organisations, where do I start? Unelected bureaucrats, United Nations, who voted them in? I didn't. World Health Organization, who voted them in? I didn't. Who's leading these organisations?
Yeah,
are they people that you would like to be at your bedside looking after you? Actually, would I like Klaus Schwab sat at my bed? Would I like Tedros sat at my bed? Perhaps not. No, don't think so. And then you look at other organisations where we seem to have become a nation, well, actually a globe, pretty much, of everything that we don't want, which is digital devices and public-private philanthropic partnerships, which is involving these big organisations like the United Nations, who seem to control us all or control the narrative.
Yeah, mandates from on high.
Yeah, well, it's dictatorial. Yeah. It's tyranny.
That's the thing to be wary of.
You know, and it's money. It all comes back to money and greed. And this is where I have the real issue, is that the care. Who cares? Nobody cares. They don't care. All they care about is themselves, and about how they're going to get the next buck for the next project, how they're going to exploit people, the population of all of these countries, especially the West at the moment, which we happen to be completely in carnage, upside down and inside out. So are they helping us? No. Do they have our best interests at heart? No.
So they are their own interests at heart.
Own, yeah.
Often about following the money, like you say, where are the vested interests, and the personal touch being removed. Control
as well. Yeah. I mean, why would they want a personal touch? They want control. They want to be able to, so this is all about control, surveillance. They want to know what each of us are doing, where we are, where we're going, who we're speaking to, what we're buying. They want to control the whole narrative. And of course, the easiest way to control is to fear people. So how can you fear people? Health.
That's
Health
obviously a massive
immediately.
one. I mean, the main inflection point for me with questioning a lot of these big organisations was, of course, COVID. And I think the same for a lot of people. But do you think part of it is whenever any organisation or entity, could be a celebrity, gets to a certain mass, questions automatically need to be asked? Like if an organisation is a global force, maybe inherent scepticism is valid or even vital because of the sheer scale of the operation and their ability to affect lives. Like the interrogation of them needs to be very severe because they have all this power.
Yeah.
Yeah?
Yeah.
Makes sense?
You're monsters. They are monsters. These organisations are huge. Where is the accountability? Who is
That's
in
it,
charge?
accountability.
There is no accountability. You've got... The trouble is there's so many secrets, so many lies. So even when you go and look at Tedros, head of the WHO, you see him and you think, well, who's controlling him?
Yeah.
Somebody's giving him the narrative, and what narrative is he following? And how is that narrative going to help you, me, my mum, my children? How is that going to help? It isn't going to help anybody because they're in it for their own gain. They're in it to control, to produce a narrative. They're following a script. They're following the plan. But it's not in our best interests.
Do you think it'd be best to devolve things back to more of a national level, regional level, as opposed to global or globalist organisations? Would that be a counter to it?
I think there's two ways of looking at it. I mean, I'm also, at the moment, you know, with the Labour government in change, and we're looking at devolving, you know, the devolvement of power. We're looking at counties ruling each other. So, I mean, what does that mean? Does that mean I'm going to have to come from Cornwall to Devon to a new system, to a new governance? Are you going to have new rules in Devon? Is there going to be a new speed limit and I'm going to have a different one in Cornwall, or am I going to get a different penalty in Devon? So we're looking at devolving to local powers, but we're giving local authorities, and this is where the rub is, we're giving them all the money and all the power to do what they want to do locally for supposedly the best interests of their people. But that's not the way I'm seeing it. I'm seeing a very fine line between devolving areas and federalism.
Yeah, I see.
So where does that line?
Yeah.
It's blurred, because are we heading for a United States of America type of federalism where we're all going to be governed with our own little states, if you like? Our counties are going to become states, and then we're going to become so separate that if I'm living in Cornwall, am I only going to get 3 permits in the 15-minute city type life? Am I only going to get 3 permits to come over the Tamar a year? Or am I going to need special permission to travel? To my movements are going to be restricted. I'm going to be watched. I'm going to be surveyed. So you see where this is going. We're devolving to local powers, but how much power are you giving local people? And who are the local? Are they local? Because I'm seeing people being flown into Cornwall and flown into Devon from all over the country, from all over the world, actually. I think we've got a CEO or somebody high up in Cornwall Council that's come from Australia. So are we looking at local people, local governance, local powers in the interest of local people? I don't think so. Personally.
Well, what's the best counter-argument to that scepticism? I.e., is it bad to be too negative or maybe paranoid about any position of authority? Or is it possible that some of these people do have human interests at heart? Or some of these things are just a long line of cock-ups? Are those counter-arguments you consider?
Yeah, of course. I mean, all counter-arguments have to be considered, and I think that's what's so important in this day, in that we need to carry on debating. And I think everything needs to be put on the table. So, yeah, of course there are good people around. Of course there are. There are tons of good people around. But, you know, it goes back to the old saying, doesn't it? One rotten apple in the barrel can spoil a lot. And I see good people being made gooder. Does that make sense? It's this altruism. It's this altruism. It's this virtue signalling. It's protect the NHS when the whole COVID agenda started. Protect the NHS. You have to be seen to be doing something for your community. You have to be seen to be good.
An outward show.
An outward show. Yes. You know, you've got to wear the mask. You've got to volunteer. I mean, we've got an NHS volunteers army now. So the NHS is being run by volunteers. Because people are good. Because people do things for us. People look at the NHS, it's the national treasure. They look at the local community. We'll help in the local community garden. Fabulous. That's fantastic. If you're doing it for the right reasons.
Right.
But don't do it for this fake altruism where you feel you've got to be seen to be doing something because everybody else is doing it. Where actually, what I can say is that people that have been virtue signalling and all of this altruism that I see has driven many of us into a hole. Because these people that are all going, yes, we'll do this, and yes, we'll participate in a clinical trial, we'll help the cause, we'll protect the NHS, we'll take an injection to protect our colleagues at work. All of these people, what are they saying to the rest of us? They're dragging us into a 1980, well, we're already in 1984, but they're driving us into this dystopia. And I feel like saying, look, it would be far more altruistic and far better for you to say no. It's a really simple word, right? N-O, 2 letters. Just say no. Say, I'm going to go and help my mum today, or I'm going to go and help the lady round the corner with her shopping. And you do those things, but you don't go bragging it. You don't go saying, oh, by the way, this afternoon I did this for that, I did that for that. You just do it because you want to.
So do good as its own end.
Yeah, because it could be you one day in that position. The little lady round the corner whose washing machine's broken, who needs her laundry taken to the laundrette, or needs you to do her washing until she gets the washing machine, or she needs a loaf of bread from the corner shop, or maybe she needs a lift to her outpatient's appointment at the hospital. Those are the sort of things that you do because you want to, because you genuinely care. And it's not something that you're going to go home and go, tick box.
Yeah.
I did this, I did that. So now it's not, it's unconditional. Whereas now everything's conditional and it's noticed and it's honoured.
Yeah. I take all those points. And that's murky territory in terms of, again, going back to the motives of why people do what they do. But do you ever worry, back to the question, that maybe sometimes people can be too skeptical or cynical about authority or these big organisations? Because it might just be a list of cock-ups, or sometimes they might have the best human interests at heart and they just get something wrong. Or just because I generally believe it can be a dangerous road to become too cynical if you question everything. Interrogation is important and accountability, but I just worry sometimes about the lack of trust, I guess.
Trust
in organisations or authority entities. It's a question of, who do you trust? What do you trust?
I don't. And, you just said just now, question everything. I'm afraid I do. I to be honest, I'd even question who I am sometimes. I question myself about whether I'm gaslighting myself, because I think the whole planet has been gaslit so badly over the last 5 years. And I think gaslighting, it's such we throw away that word gaslight, and not many people really give it much consideration as to the damage that it does and how poisonous and venomous
the true definition
gaslighting actually is. And I think when you've had a world, and especially when talking about the UK in the last 5 years, where we've been gaslit over and over and over again, I think you're right. You do almost become too cynical. You do have to question everything, including, am I gaslighting myself?
Yeah, or am I the arsehole in this situation?
You do. You constantly have to question yourself. Am I joining too many dots? Have I joined those dots in the wrong way? Am I being over cautious?
Yeah.
Am I being over cynical?
Or zealous about something, or... Yeah.
Yeah, you do. You question yourself. But that's how the last 5 years have made me feel.
I see. It's just, I don't know, it troubles me sometimes about the lack of trust. I mean, would you say generally you trust people on a person-to-person basis? And that's the best policy for life? Yeah, if you know them.
If I know them.
Right.
I think, my grandmother used to say, if you can call people your friends, because you could trust them. What is a friend, right? A friend is someone that watches your back, that's there for you when you're down, and you're there for them, so it's reciprocated. And if you can count those people on one hand, you're doing well. 5. If you can say that you've got 5 people in your life that will watch your back no matter what, and you will watch theirs, then I think you're doing pretty well.
All right, so we're back from the break. I guess one thing I'd just like to add is I'm an optimist, fundamentally. I think it's generally best as a policy to give everyone the benefit of the doubt and go into things with good faith until they prove you otherwise. But I still think it's healthy to question big organisations. I suppose that's my general philosophy on life. I'd rather be an optimist and see the light and see hope, and, I often try and bring you up when I can, or Steph, or whoever it is. I feel like that's my role on earth in some way. Everyone's got a different role. I feel like that's who I am. I'd rather believe in the good and in a expansive future. Could be a Leo thing as well. I don't know.
I know, but I think that's interesting because your glass is half full. And I always try to make mine half full as well. And the way that although it's a different half full to yours, it's a half full where I feel that I am questioning everything, and I am trying really hard to see the good. But by looking so hard, I'm able to advise or inform people how to get the best
of
where they're going to. So if you're going to go for a hospital appointment, for example, what's the best thing to do? You know, take somebody with you. Make sure you've got somebody making notes if you need. Take questions, prearrange questions that you think you might, write them down. Make sure that your family know where you are. Make sure that you know if your loved one's had a drink. Little tiny things that you can do to make the outcome far better. So for me,
measures.
Yeah, for me, using my cynicism, if you like, and questioning everything to the point where I'm like, I want to make sure that this is absolutely bona fide. I think we can prepare people much better.
Of course, I understand.
For giving them the best.
And I know your motive is a good one and a pure one. It's like I said, I don't know. It could be different colour glasses or different shaped glasses.
Yeah.
Mine's an interesting schooner. Yours is a Pepsi
I think it could be.
mug or something. I don't know.
Yeah.
But let's hope they're both half full. So you're an amazing researcher, diligent and very astute and inspired. I'd like to ask what tools and strategies you use for research and how would you advise someone else, I'm sure there's people listening who are interested, someone else to look into someone, a person, a company or a topic. What tips would you give someone else?
So, people might be a bit surprised to know this. Although people that know me won't be surprised to know it at all.
All right.
I am totally anti-tech, right? So, I mean, you can give me a computer and I'll be looking for the button to switch it on.
Right.
Really, it's that bad. And so the way I research for 16 hours a day. Now, I know that sounds crazy.
That's devoted.
It is, but it's kind of almost, I suppose some people would say it's obsessional. I'm nosy. You see, I keep saying that word keeps coming up. I haven't got a big nose for nothing. I'm nosy. I operate on an iPad. I have got a new iPad now, which is, does all sorts of things. I'm not quite sure what it does, but it's very basic what I do on it. But I've always worked on an iPad. I've worked with a computer too. I mean, I write on a computer, but it's a copy and paste and it's a Word document. And that's about as far as I go. People start talking to me about lots of different tech and I go, no, I can't do it. So I operate on an iPad for 16 hours a day and I go very much into, I guess, I don't know if this is going to sound really kind of cheesy too, but I feel I'm guided. I feel that I get divine inspiration.
Interesting.
My name's Deborah and I read a lot about the prophet and judge in the Bible, Deborah, who was a feisty woman. Feisty she was.
Nothing like
curious, curious. And she probably would go places that many other women wouldn't go. She'd put her foot in it a few times. She would be very sort of strong-minded. And she led her army because the leader of her army, Barak, wouldn't lead the army. He was too scared. So she led the army. Feisty, determined. She was a mother figure, but nobody even realised, or nobody really knows whether she had children. Did she have another half? So
just a general matriarch.
Yeah, just a general. And she was a powerful, feisty woman. And obviously did her homework. And I feel as though she's kind of driving me.
Interesting. The animus.
Yeah. And it's like, I feel a bit of a warrior. Does that sound really awfully cheesy? Because it does sound cheesy.
I suppose slightly, but I know what you mean.
But it's like, I have this drive within me to find out, and it comes back from curiosity, inquiring mind, and finding out what's best for people. How can they solve a problem? So it doesn't have to be just health. Somebody can come to me and say, oh, I'm having a real problem with, I don't know, British Telecom, Orange, Marks and Spencer's, Tesco's, any good brands will do.
Sure.
What do I do? And I go, we'll go straight to the CEO. And they go, what? well, I've been phoning customer. Oh, no. Don't go to customer services. Go to the CEO. Go to the top. So always start at the top.
Okay.
With research, for me, there's an amazing website, actually. I'll give him a shout out. It's called CEO Email, ceoemail.org. And if you go on there, any organisation you want, whether it's the royal family, whether it's the British government, whether it's an overseas government, whether it's a company, you will get the direct email to the CEO. Okay. It's an incredible resource. So I always go direct to the CEO if I want information. And then with regards to research for whatever I'm looking at or being interviewed about or interviewing other people about, always find out who's at the top. Who can you see first?
Okay.
And then start to join the dots. So this person is in this organisation. Where were they before?
Well, say Dame June Rain.
Oh, Dame June Rain.
If a name catches your attention or a person...
She's on my radar.
Where do you begin? When you first type the name in, is it Google first of all?
Never go to Google. Never use Google.
So where do you type the name in first
so I go
when you're beginning the hunt?
I go to a search engine. Usually use Brave or DuckDuckGo.
Right.
And then I'll page in the name, and it'll just the first thing you get is a wiki page, isn't it? You get the wiki page, which gives you the overall, just a summary of that person's history and their background. And then from there you start to look at, well, where did they go to school? And where did they live? And who were their parents? What was their background?
So you get that from the wiki.
Get it? You start off at wiki.
And then where do you go next?
And then I tend to go, well, I just tend to Google names, and then I'll look at anything that I can find.
So a picture of the family tree almost?
Yeah, I'll get a family tree. June Rain's was interesting. Chris Whitty's family tree is very interesting for anybody that might want to go and have a look. His father's side particularly. So yeah, I'll go and look at their history. Susan Mickey, she's another one that I went to look at her family tree. Blue Blood, she sold a very expensive Picasso. But huge history there. So yes, I will always look at Ancestry. Don't go to ancestry.com and all that stuff, because of what they started, which is give you DNA, will trace your history. It's all information and data that they're collecting on people. So yeah, I'll look at their history, look at their schooling, education, and then it's YouTube.
Okay. So
I go to YouTube and Rumble, and I go back. So I'll put in June Rain, for example, 1970.
So try and go back to the start of their public appearances?
To the start. Well, I'll just put any date in.
Right.
So if June Rain's in her 70s. So she will have been at school in the 60s, 70s. So when will she been in university? Probably late 70s, early 80s. So I'll go back to see what are the clips of June Rain. What did she say back then? What did she start out as? She was a doctor. How did she get into the MHRA? What did she do in the MHRA when she first got there? How has she gone through the ranks? Who is she associated with? Who was her predecessor? Where did her predecessor go? Well, her predecessor went to the Bill and Melinda Gates Foundation. Oh, that's interesting. Perhaps that's maybe where she's going to go. What's the Bill and Melinda tie-up with the MHRA? And then you start to see some links.
Yeah.
And then when you start to put in somebody's name and you put in all those big organisations that you were talking about, like the WHO, United Nations, etc., then it completely explodes, because you end up going down a rabbit hole, which has got another Warren, and then another hole, and then another hole. And in the end, you almost lose where you started. You have to track back through your thread.
Do you map it?
Yeah, I brain map it. So because I'm on the autism spectrum, I have a blue screen. People on the autism spectrum always work. Everybody works differently. Some people think in pictures. Some people think in text.
Yeah.
Some people learn in text or learn orally, academically. I'm a picture. Right. I learn in pictures.
Okay.
And I think in pictures. So I have this big blue board in my head.
Right.
And it's quite a bright blue. It's not electric blue, but it's a bright blue board. and it's magnetic. I know this sounds crazy because it's in my head.
It's your head.
And
your
so
rules.
it is my head. You don't want to be in my head. So June Rain, her name comes on my board.
Right.
It's on my radar now. It's on my board. And then I'll find another bit of information and I'll stick it on my board. And it's all in my head. And then I shuffle the board bits
That's
around.
amazing. You're holding
like
it all in your head. You're not using, I don't know, images, copy and pasting on a document.
No.
It's all entirely in your
It's all
imagination.
in my head. It's
That's
all
incredible.
in my head. I mean, I use a notepad to jot down notes.
Yeah.
But then when I've got my blue board, I don't know if anybody's seen a series on TV recently called Patience. She was a criminologist and she's on the autism spectrum.
Right.
And the way she operates and the way she works and the way she does things. And I was watching it and I was thinking, I do that.
Nice.
I do that too.
Sure.
And slightly differently, but I have got this blue board and it's like a jigsaw and I move stuff around and I try really hard not to, you know what it's like when you get a jigsaw and you think that bit fits, it does, and it doesn't fit, and as much as you want it to fit, it doesn't. So I have to be quite strict with myself.
Don't put pieces in place too fast.
No, don't put pieces in
They're kind
place
of floating
too fast.
in the air until you put them in place.
They're kind of like magnetic, so I can kind of move them around a little bit. And then
Big blue fridge in your head.
Yeah, no, it is. And then when I've got a picture, or what I think is a picture,
The full picture,
or at least quite a bit of the picture.
Sure.
Maybe there are some pieces missing. But then you see, I find the audience absolutely incredible. Because then I can throw out my jigsaw to the audience, not as a done deal. It's like, hey
test
guys,
audience.
yeah,
I think something's missing. Where should this piece go?
yeah, because the audience, honestly, I think that's
collective
one thing
problem solving.
Oh, it's incredible.
Nice.
It's just incredible. I think that's one of the things that I've learned more than anything. And I think a lot of that's down to Stephanie as well, is getting the best out of your audience all the time. And the audience are incredible. When I talk, and as I'm talking to you now, there are going to be people listening that are doctors, that are lawyers, that are accountants, that are professionals, that are other autistic people with special interests.
Yeah.
And that's what's really interesting.
Sure.
You don't have to
Specialisms.
you don't have to have a PhD or be a professor. You really don't. If you have a special interest.
Yeah, innate understanding and a drive towards it.
I tell you what, if I want to know how to fix a computer, I will go and find somebody on the autism spectrum because they know what to do. Mathematician, I'll go and find somebody on the autism spectrum. They're very good at maths. Systemizers. So you learn to appreciate your audience. And when you're throwing things out and you're saying, look, this is what I'm seeing. I'm seeing that 34 million people have uploaded the NHS app and they're all giving this information and we don't know where that information's going. And I'm seeing that it could be going to here and there. And it's like, I've seen this. I've joined these dots. Am I right?
Do you think autism then is kind of a bit of a superpower? Or has it helped you in your life's goal?
I love it. I love it.
How particularly would you say it's helped? Like you say, you talk about systemizers.
Systemizers.
What does it add? What's the edge that it adds? Is it a tirelessness? Is it a level of astuteness in terms of connecting things in a lateral-minded fashion?
All of that and more. I mean, people say to me about autism and I get so upset because people think that if you say autism, you're automatically learning disabled, and you're not. Learning disability is a separate condition that can be associated with autism. But also, if you're blind, you can have a learning disability. If you've got cerebral palsy, you can have a learning disability. So it's not specific to autism. So I don't have a learning disability. It's passion. It's drive.
And a focus on one area almost?
Focus. Yeah. Once
like
you start.
focus.
Yeah. Laser focus. Drive, determination, curiosity, being able to think out the box.
And if something's wrong, does it this is a bit of going on a limb, but possibly does it annoy an autistic person more if something doesn't make sense?
Yeah.
Because they're working within a system of logic to a degree.
Yeah.
Often fiercely.
Yeah.
Like with the puzzle, like it must fit, it must make sense. Yeah. If something's up with the NHS, say in your case, or an aspect of health, is that part of what drives you tirelessly? Is that it must be fixed?
Yeah.
I must do something. It's like a compulsion almost.
Yeah, but there's always a solution. This is what's so frustrating, is that, and I don't think this is specific to autism, but when you can see a solution, a simple solution, and nobody's seeing it, the simplicity, we're missing out on simplicity. We want everything to be complex. We're living in a fast world at the moment. Information is cascading in on us all the time. We're being overloaded. We need to just pare it back, calm down. I mean, for somebody like me who gets really passionate and really kind of having to say, calm down is quite difficult.
Sure.
But you do have to just calm down, take a breath, stand back and simplify it.
Well, on a more positive note, where do you find your hope and joy? Could be family, could be sunsets, could be cats. What brings you hope and joy?
Oh, well, let's grandchildren. I have to go to the grandchildren first, of course. The grandchildren first, then the cat. Oh, cats, animals, animals. I love animals. I absolutely adore animals. I think I actually prefer animals to people. I shouldn't really say that, should I, as a nurse? But I do love animals. So yeah, animals. But you know what? Even though people say to me, go to nature and go and have a walk in the park and see the daffodils. And yes, that's all beautiful. But for me, maybe it's because of my autism. For me, my joy is researching.
Right.
Genuinely is. I love it. I'm
finding stuff out.
Oh, I'm so nosy. And then I find stuff out and I want to tell everybody.
Right.
This is what I found. Do you think it means what I think it means? Could it mean this? Could it do this? Would we be able to use that for this? I mean, now I'm looking...
so the conversation's part of the attraction too.
Yeah, the conversation. Oh, yeah.
That's the joy.
Yeah.
Right.
This is the joy. Talking to you now.
Sure.
Sitting talking to you. Actually having eye contact with you.
Yeah.
Talking to you and knowing that you're not looking at your phone, that you're not busy tweeting somebody, Xing somebody, Facebooking somebody, sharing knowledge. It doesn't have to be on a screen where you're researching, but just go talk to people. Talk to people. And you know what? The other day, I woke up on Friday morning and it gets to the point where you just don't know what the day's going to bring. You don't know what you're going to wake up to. And I woke up to a lovely email inviting me to speak to Elon Musk's dad, Errol Musk. And I'm thinking, what? I'm actually going to speak to Errol Musk. This is surreal, really surreal. Anyway, of course I agreed to it because I like to speak to people.
Sure.
Well, I had the most delightful conversation. I really did. And it was because it was Errol and I and Andrew, who was hosting. We were chatting like we are now.
Sure.
And we were sharing life experiences. And bearing in mind that Elon is very much into AI agents, into tech, into Neuralink, which is like sending my brain into complete scramble.
Yeah.
And Errol was sitting there and he was saying, well, but we've got to let the youngsters, get on with it. And I'm going, no, Errol, they need to be coming and talking to us. And Errol, if you and I were at dinner, we wouldn't be sitting on the phones. And he was, no, absolutely not. Absolutely not. And for all of our differences, we came together and we were able to discuss and converse and debate in a friendly, amicable, gentle way, not adversarial at all. And and ever since that conversation, I've been thinking it's so easy. This is what we've lost. We've lost the ability and we've become too frightened.
I don't think we've lost it. We might have misplaced it, but you
or
you get it back.
Become frightened, maybe. Become scared that we're too woke. We mustn't ask questions. We mustn't talk about the good old times. We mustn't talk about paper and pen. We mustn't talk about the fact that, the good old times actually and the wise experiences of your wiser elder people are really, really significantly important today. Because where are we heading?
Sure.
Let's just go back to having a chat. Let's go back to talking about things. And if you're worried about something, or if you're thinking, no, that's not right, that maybe that's not the right course of travel, you should be allowed to discuss and debate. And that's what we've lost. Science is fluid. Life is fluid. Changes are happening all the time. We need to be able to have a
dialogue.
Gentle one-to-one dialogue.
Well, just helping people bring you joy as well.
Yeah, but by telling the truth and by pointing out things that may help people moving forward is an absolute joy.
Yeah,
it's
the act of helping does bring you joy, lifts you up.
Yes.
To know you've made a difference.
Oh, do you know what? I've always said, people say to me, Debbie, we're so grateful that you've brought this and this and this up. And I go, you know what? I'm so grateful for you. It's a two-way street. Research, dialogue, conversation, knowledge, empowering.
Because you're spreading light.
But it's passion. It's doing it with the right intention. It's intentionality, I think.
And so part of it's energy then. Almost energy exchange. I give it to you, you give it to me.
Yeah.
The joy of that.
Yeah. And I've got ADHD. I've got splashes of ADHD in my autism as well, because every single person on the autism spectrum is different. So I've got a splash of this and a splash of that. And it makes me passionate. It makes me do all of this. Sure. It makes me kind of like this. But it drives you. It's like an engine. Yeah. And I'm sure that, at some point with ADHD, your engine does get burned out, and you do end up on burnout where you have to sort of like stop for a couple of days, perhaps, and take time out. Yeah. But then it's straight back in again. It literally is straight back in it. Yeah. And it's, hello, I was down for a minute, licking my wounds.
I was in the wings, back on the main stage.
But no, I'm back, spotlight's on. Although, funnily enough, I don't like being in the spotlight. I'm actually quite a quiet, private person. Although I come off gobby granny and nosy, I'm actually quite quiet, quite reclusive.
Well, you can be an introvert and an extrovert. I'm kind of both. Yeah. You can have those two switches, those two lanes.
I'm definitely
When you're doing what you got to do, you can be all singing or dancing. But as a general disposition, often you're quite quiet, introverted.
Yeah, I am.
Reclusive, all those kinds of things.
Some people won't see me for weeks. They don't see me for weeks, and they go, are you okay? We haven't seen you. The car hasn't moved. Oh, no, I've been busy. Because I've been digging,
doing my
joining dots. I mean, my house is there's notebooks everywhere. Paper, pens, absolutely. You're too young to remember, but I'm not. We used to go into the doctor's surgery, and there used to be shelves and shelves and shelves and shelves of brown envelopes, and they were all the patient records. Those have all gone now. Paper. My house is full of paper. Books.
They bring you joy.
Books bring me joy. Books. When you look at, again, information, what made Michelle Obama? What made Boris Johnson? Read their autobiographies. Read what
Again,
other
the
people...
information's out there. They're telling you the story.
It's all there. You just literally have to join the dots. And I happen to love dots. I'm not always saying that I join them in the right order.
Sure.
But I have them on my blue board.
Sure.
So then I'll throw them out to the audience. And then the audience will either go, Debbie, over the regulate. Top. Nah, nothing to see here. Or they'll go, actually, you're onto something. So it's a two-way dialogue always.
Sure. Well, for my last question, if you could sit down with any three heads of big organisations and have a good old chat, who would they be?
I've thought of this. Oh, it's so difficult. It's really, really difficult.
Because there are so many bastards.
There are. Yeah, there are. I want to have a much longer chat with Errol Musk because he's a politician. He's a very influential businessman. And he's also got a son with Asperger's. Although we're not allowed to mention Asperger's anymore because it has been outlawed from the Diagnostic Statistic Manual. So now it gets known as ASC. Love to talk to Errol more about life.
Because when you spoke the first time, you spoke more on...
privacy.
Right, so certain topics.
Privacy, yeah. I'd like to speak to him about...
You want to go broader?
I want to go really broad. I'd love to talk to him about... So he would be one of my dinner guests.
All right. One of the dames? The deadly dames?
It's got to be Dame June Rain.
Yeah, she's number one.
It's got to be Dame June Rain. The reason being, I think, is because we're a fairly similar age.
Yeah.
And I want to say, June, what are you playing at?
We come from the same place in the same era.
We know
How have you changed so much?
Why has this happened? Yeah.
Where'd you go wrong?
How did this happen?
Yeah.
It's like, really? You and I, we learnt from the same hymn sheet.
Yeah.
We sang the same hymns.
So how come you've gone off key?
What happened?
Yeah.
So Dame June Rain would be one.
Just mainly ask her where it went wrong.
Really, what on earth? What are you thinking of?
Yeah.
It's like, really, what are you thinking of? Because I'm utterly...
Flabbergasted? Gobsmacked?
I don't think there's a word.
Flabbersmacked.
I am. Really, I really, really am. I can't honestly believe it.
Gobgasted.
Yeah. And then my other guest would be... I think I could have quite a productive conversation. And this is why I would be choosing these guests, because people are going to be going, what? Why would you want to speak to that person? I'd like to invite Susan Davy to my dinner party. She's the CEO of South West Water.
Right.
And I think water's a very big issue.
Sure.
And I'm seeing water companies, believe it or not, even though I've had a million problems with water companies, I'm seeing water companies being set up by other big organisations and by the government. And
subsidiary then, kind of?
I'd like to warn water companies what they're being... I mean, this whole climate change nonsense, they're being roped into all of that. But down here, for example, I mean, here we are in Devon.
Yeah.
And it was only last year that we had an outbreak
big old
of
fuck up.
cryptosporidium. But it was a very interesting exercise, wasn't it? Considering the WHO have put out a map of what country has what epidemic, and we seem to be top of the list for E. coli and cryptosporidium. It was a very interesting little exercise, don't you find? Last year, I always find these things are exercises. Like, how long did it take you to discover? Yeah, warm up act. You know, how long did it take you to discover the crypto? Where did you find it? Where did it come? How many bottles of water did you
put it there?
Yeah. Why did you put it there? Or who put it there? And actually, how many bottles of water did you need to use for the public? And how many members of the public complained? How many members of the public were hospitalised? What kind of symptoms did you have from it? Did you have any longer? Did you have to pay much in compensation? I mean, you know, the data, and I would like to say to Susan, did you have the UKHSA on the phone to you every single day? I bet you did. I bet they were pestering you. I bet they wanted to know absolutely every single statistic and what you were doing, how you were managing it, how long it lasted, what the after effects were, how you can prevent it, what would happen if it were to be in a big city, for example. You know, mapping it all. The UKHSA are using you, South West Water, as a test bed and a test run, as a tabletop exercise for what if we had a bigger... And water's very important. You know, we can do without food for a while and we can get by on bits and pieces of food. But water, clean water, you're going to need. So, yeah, I think that would be Dame June Rain, Susan Davy, and I think I'd bring in Errol Musk, because I think Errol Musk and June Rain, I think, would be a very interesting combination because we're all the same age. Susan Davies a little bit younger, but Errol Musk, June Rain and we're all of the same generation. So how are we all thinking such different things? What changed?
And also maybe where are the commonalities?
Yeah.
There might, you know, that you'd hope there'd still be those.
I'd hope we could educate each other.
Yeah,
and I certainly felt that when I was speaking to Errol, he was educating me and I was hopefully educating him in, well, this is what's happening in the UK. And he was, really? So even if it was to give him one piece of information of something that's happening in the UK, and we talk about it, we go, but that didn't happen in our day. You know, like 1 in 2 cancer. Where did that come from? And I said to him, where did that come from? And it's like, well, it just materialised, but I don't remember it in my day. And I'd be saying that to June Rain. Where did that come from? Who invented that statistic? So I think it would be an enlightening journey.
It sounds like some dinner party.
It would be very interesting. I could actually, I've got room at my table for a few more, so I could make it even more interesting. I could maybe stagger the dinner parties. I've got so many people I'd like to
More
speak
people are
to.
arriving at 8, so you need to fuck off.
Yes, quite.
You've got an hour and a half.
Sorry, I've got Fauci coming in a minute and Witty, sorry.
Well, great. Thank you, Debbie. Good to talk to you.
It's amazing to talk to you. Thank you so much, Sam. It's been brilliant, and keep questioning everything.
I will. All the best.
And you too.
Thanks for listening. Please like, subscribe, comment, rate, share, all that good business, and stay tuned for more fantastic interviews with brilliant guests. There's a seat waiting for you.